Good afternoon, and welcome to today's Side by Side with the Division of Mental Health, Developmental Disabilities, and Substance Use Services, Improving Our System Together monthly webinar. Before we get started, here are a few reminders about the webinar technology. Please make sure you're using a computer or smartphone connected to the internet and the audio function is on and the volume is turned up. Please make sure your microphone is muted for the duration of the call unless you are speaking or asking questions. Questions can be submitted anytime during the presentation using the Q&A feature located on your control panel. We will answer as many questions as time allows after the presentation. American Sign Language interpreters and closed captioning options are available for today's event. The American Sign Language interpreters for today are Danette Steelman Bridges and Susan King Lanier. For closed captioning options, select the closed caption feature located on your control panel. To adjust your video layout and screen view, select the view feature located in the top right-hand corner of your screen and choose the view that works best for you. Today's agenda topics include introductions and MHSU, IDD, TBI, system announcements and updates. We will discuss a DSP grant opportunity, National Recovery Month, the DMH-DDSUS Perceptions of Care Survey, and the North Carolina Mental Health Block Grant for fiscal year 2025. There will also be time for questions after the presentation. At this time, I would like to turn it over to Kelly Crosby, Director of the Division of Mental Health, Developmental Disabilities, and Substance Use Services.
Hi, everyone. Thank you so much, Dina. This is Kelly Crosby. And as Dina said, I'm the Director of the Division of Mental Health, Developmental Disabilities, and Substance Use Services. For those of you that don't know me, thank you so much for coming today. You are very welcome. As Dina mentioned, we've got a lot of things we want to go through today. I'll be doing a lot of talking, but I'm really excited to be joined by 3 of my team members today. So that's really exciting for you to hear directly from them. There's a lot happening this month, and so we wanted to touch base on quite a few things, and we hope we have lots of time for questions today. So if you go to the next slide, I want to remind folks that engaging with you all is really, really important to us. So we have lots of opportunities for engagement. And this slide just shows our routine advisory committees. So I want to make you aware of those meetings. In particular, please note on the bottom in that gray box, we have our advisory committees that are based around these new budget investments we got from the General Assembly. Pretty soon, we'll be giving an update on what we have spent and the programs that we've supported through some of these new investments. But just wanted to remind folks that we have these opportunities to engage. We need you to join our committees. We want you to advise us on how we're investing dollars, but on how we're doing policy in the system. We're going to talk a lot about that today. Some investments we're doing with our mental health block grants, some programs we have been funding for some time. It's very important to us that you know about those programs, that you have a say in the value of those programs. You have a say in the new programs that we fund. So we welcome opportunities like today's Side by Side and all of our other advisory opportunities to engage with you. Next slide, please. So I'm going to do a whole bunch of announcements, everyone, and I'm very excited about all of these announcements today. Next slide, please. Our strategic plan. Yay! Thanks to everyone who gave us comments on our strategic plan. We haven't done one in a long time. Remember, it's part of our job. It's part of our job to assess how our public mental health substance use, IDD, and TBI system is doing in North Carolina, and to develop a strategy that has goals, measurements, and helps us think about how we fund our system. And that could be funding through our block grants, through state dollars, through the Medicaid program, and how we partner with you all to make our system go forward. These are our final 7 goals. There is a new goal. I mentioned this in some other meetings based on your feedback. We added a new goal, which was to amplify recovery and community-based services. So look for that in the interventions, goals, and measures under that program. when this is released. So when is it going to be released? It's going to be released towards the end of September. It's not on the slide, but we're aiming for September 23rd right now. So it'll be a big old plan, hopefully with a nice executive summary, where you can see what our goals are and what we hope to measure in each of these 7 priorities for our mental health, substance use, IDD, and TBI system here in North Carolina. So super excited about that. We are also planning to have kind of a town hall where I'm going to walk folks through it. So we'll give you like a week or so to digest it. We'll have a town hall. We've been thinking about doing it in the evening, so more folks can attend. I know this time works for some people and doesn't work for others. So we're very, very excited about releasing our 5-year strategic plan. And it is our commitment and our partnership with you. So super excited about that. Next slide, please. I think folks noticed, but maybe if you didn't, I want to let everyone know that we did have SAMHSA here. That's our federal funder, right? That's the Federal Substance Abuse and Mental Health Services Administration. And in particular, the director of 988 came. So the federal director of all the 988s across the nation. Here's some snapshots. We visited the Real Crisis Center. And we also had Shireen Carrico and her team from the Peer Warm Line that were there at the Real Crisis Center, who operates 988. Then we were able to go to Recovery Innovations and look at behavioral health urgent care, a facility-based crisis, a peer center. So it's a very exciting day. It was a moment for us to brag on the good work that you all are doing here in North Carolina. We were there, but do you see, we went to Real, we went to Recovery Innovations, we went to the places where you all are making these wonderful crisis services happen. And so SAMHSA was very excited. They're particularly excited about how our 988 line and our Peer Warm Line are working so collaboratively together. They say they've never really seen this before. It's very exciting to them. They got to talk with folks who answered the phones and staff who worked at centers. We had CFAC there, we had consumers and families, and it was just a wonderful time to talk about North Carolina, to share and brag on that with our federal funders, and also to ask them questions about federal policy and funding. On the next slide, hopefully folks knew that yesterday was the first annual 988 day. And again, we've shared statistics on 988 before. We've got about 8,000 callers a month calling, and we'll be sharing in the future some more exciting advancements that we'll be doing with the 988 line. So again, this has been a wonderful thing for us in North Carolina to be able to promote mental wellness, a place to call or for advice or to seek services. People are calling for all kinds of reasons, as we've shared with you before, but it's really cool that we had an annual national celebration of 988 yesterday. On the next slide, we're actually seeking some volunteers who have people who have experienced what it's like to call 988. We'd like to hear your experience, and if you're willing, we would like to video you. We would like real North Carolinians talking about their experience with 988. We want to learn from it, but we also, if you're interested and willing, we'd love to share your story. You know that I'm a big believer in people with lived experience, myself included, sharing their stories, sharing your journey, sharing your experience. And I'm appreciative of, we've gotten a lot of volunteers already. So we welcome volunteers. The slide will tell you how you can volunteer if you want to share your 988 story. Hey, guess what? If you have a not good 988 story, call too, okay? We want to hear about those because those are opportunities to improve things, okay? We're very proud of our 988 call center. No one is 1,000% all the time. Love to hear places we can improve, but also very interested in hearing success stories from folks calling and willing to be featured in our very own 988 commercials here in North Carolina. Next slide. It is Suicide Prevention Awareness Month, which obviously is part of the reason that 988 Day was established in this month. We will be celebrating with a lunch and learn tomorrow at 12:30 p.m. We're actually going to talk about North Carolina's suicide prevention strategy. You may not even know that we have one. We do. We have one. And things like 988 and all the crisis work that we've been focused on are part of our suicide prevention strategy here in North Carolina. There are plenty of other things as well that are part of this broad coalition, this broad work that we're doing around suicide prevention. And we want to make sure you are aware of it. Suicide impacts all of us as humans. It just does. It's something that we all care about it. Many of us have personal experience with family members who have died by suicide or who are survivors of suicide. And our goal always is to make sure people know resources, they get empathic, kind, supportive help when they need it. They know where to go, they can trust where to go, and families know where to go. So I invite you to attend this webinar to hear about what we're doing in North Carolina, and always please to give feedback on what we could do better. Next slide. Uh-oh, did the next slide go? Are we stuck? There it is. As I said, it's a very, very, very busy month. Another webinar that we're doing, we're so excited about this. Our fetal alcohol spectrum disorder webinar, recognizing the red flags. For some time now, we've been working with advocates in the FASD community about how we can do more to draw awareness, to bring skills to physicians, folks who are diagnosing, more treatment, education, and awareness to communities. And this is just a start, you all, but it's a very important start. So we invite you to come to our FASD webinar later in the month. It is FASD Awareness Month. And so again, we'll be presenting some information to the community, but no, we continue to try to think of ways that we are expanding our treatment, diagnosis, and service offerings for individuals with FASD and their families. Next slide, please. Guess what? I'm going to turn things over to Tina because we didn't forget that it's Direct Support Professional Recognition Week, but I'm going to let our very own awesome Tina Barrett talk about that, as well as what we are doing to support direct support professionals in our system. Over to you, Tina.
Thank you. I'm Tina Barrett, and I'm the IDD team lead over at the Division of Mental Health, Developmental Disabilities, and Substance Use Services. And as Director Crosby mentioned, this is Direct Support Professional Recognition Week. We are so excited to recognize the direct support professionals who work in the field of IDD and provide those direct hands-on services to support folks with IDD. They are so critically important, and we have such a workforce shortage that we have been working so hard to address, to mindfully and intentionally recruit people into the field and to recognize our folks who do stay in the field and continue working. So we are just really, really happy to be able to present our recruitment and retention grant, which opened today. Next slide, please. And this is for agencies who employ direct support professionals. And just, I'm going to go ahead from the outset, go ahead and say, we do have another grant that we are looking at to support our self-directed and employer of record. It's going to be a slightly different model. So this one is directed towards our providers. We are soliciting proposals to help fund some interventions. And we're asking our providers to actually give us a proposal. We are looking at right now expecting to fund up to 100 grants at $9 million total. The funding application will be open until November 8th. I'm hoping that Jay has a link that he can drop in there to the proposal itself. And we are looking at multiple different allowable uses. It will be a one-time basis, and we're looking for being able to make the awards and get the money out in early 2025. Eligible providers will deliver Medicaid and or state-funded IDD services, including providers that work with an agency with choice, but not our EOR models. So we're asking for our providers to provide their initiatives and a budget, and also looking at some long-term recruitment retention strategies. I will say that we have a webinar that is coming up on September 11th. And we will also be having some office hours. Those are being scheduled for September 19th, September 26th, and October 3rd that will provide additional information, answer questions. We also have our email on here. Certainly, if folks have questions prior to then, please feel free to send those into the email that's included on the slide. Next slide, please. And as I mentioned, we do have our webinar, and that is scheduled for Wednesday at 1 o'clock. There is a registration link for folks that are interested in joining us for that, to help answer some questions about the proposal link, and as far as information being put in for that. So we look forward to getting lots and lots of innovative ideas and different opportunities to help support our DSPs through the recruitment and retention grant. So I don't have anything else specifically about that. So I am going to hand it over to Dee Dee Severino, who will be talking about some of our mental health area. And thank you so much for letting me present that today.
Thank you, Tina. Good afternoon, everybody. My name is Dee Dee Severino. I'm the Assistant Director for the Addictions and Management Operations team here at DMH DDSUS. And just want to say Happy National Recovery Month, everyone. September is National Recovery Month. It's pretty cool, and I appreciate the opportunity to share a few slides to highlight some of our work specific to substance use and mental health recovery in honor of National Recovery Month. It is a celebration and promotion of our strong recovery community in North Carolina and across the nation. It's a time to highlight evidence-based treatment and recovery practices, especially the service providers, the peers, our practitioners, all the people in communities, that make recovery possible. And just to note, the first recovery month was in September of 1989, and it continues to grow and be even more recognized 35 years later. Excuse me. So I do want to draw your attention to some of the data that's on this slide. Specific to substance use, of the 30.5 million adults who perceived that they ever had a substance use problem, 73% or over 22 million consider them to be in recovery from an alcohol or drug use problem. And for mental health, of the nearly 64.5 million adults who perceive they ever had a mental health issue, 66%, almost 67%, 42 million considered themselves to be in recovery from their mental health problem. So that's an enormous number of people in recovery, right? So the tagline for Recovery Month this year is "Hope is real, recovery is real." And these data illustrate this so well. As you can see, well over half of people with substance use and mental health problems are in recovery. Now, that's not to say that recovery is quick or easy. It's a journey, and that can sometimes be kind of long and twisty. But these data show that well over half of people with substance use or mental health issues do recover, and that's millions of people in recovery. Next slide, please. So in honor of Recovery Month, I wanted to share a little about some of our substance use recovery specific work that's happening in our state. So these next couple of slides, we'll speak to some of that. Collegiate recovery programs. College campuses are often described as recovery hostile. And I don't particularly like the word hostile, but many are not, conducive for students in recovery. And so collegiate recovery programs are important because they offer students who are in recovery, as well as those who choose not to use, they want to be substance free, offers support and alternatives that still allow them to experience, that college environment and, feel like they're part of things that are happening on their campuses. So DMH DDSUS first began funding collegiate recovery programs in 2015. We started with 6, we've expanded to 18, and that includes 5 HBCUs or historically Black colleges and universities, excuse me, and a couple of the minority serving institutions. And another really cool fact is that North Carolina leads the nation in the total number of collegiate recovery programs with over 30. So we're supporting about 18 of them, but there are certainly a whole lot more that are supported by their campuses and communities. So that's a pretty cool thing. For the schools that we support, their funds can be utilized in a number of ways, depending on what the school has determined, as their priority needs. So funds can support staffing, which is often peers or student ambassadors. The funds can support sober events and activities like sober tailgates, even alcohol, drug-free spring break outings and activities. And the funds also support schools to create dedicated spaces for students to come together to study and to socialize. It's just, a place where they can hang out that's free from the pressures to use. Next slide, please. Okay, recovery community organizations. Recovery community organizations or centers are places in communities where people can access resources to support their recovery. Some of you may be familiar with drop-in centers or peer-run. So we're going to talk about the peer-run wellness centers in just a second, but this is similar to that. Recovery community centers are typically operated by peers who are on site to assist people who may walk in, looking for resources, maybe to assist with employment, or career building or educational efforts. They may be looking for recovery supported housing. They may, be looking for places where they can access food or clothing or, those kinds of things. So peers are also there to conduct or facilitate self-help groups. They also provide a lot of training. Right now, many of them are busy, really busy, planning recovery rallies or other community activities to celebrate Recovery Month. So by the way, if you're interested in participating in some of these activities, if you just Google something like recovery events near me, opportunities should pop up. There used to be the Faces and Voices of Recovery website kind of kept track of all the states' recovery rallies and events, but I'm not seeing a whole lot on there this year. So I'm thinking, that was volunteer for people to add things there. So I think you'll get better results if you just Google that little phrase. And currently we provide funding support to 15 recovery community centers across the state through funding from our Substance Use Prevention, Treatment, and Recovery Services block grant. And that totals around $3 million. And we are planning to hope to expand that number by a couple, maybe 3 more this year. Okay, next slide, please. All right, as I mentioned before, I would talk a little bit about the peer-run wellness centers. They're very similar to recovery community centers, offering resources and support for individuals with mental health or substance use issues who are seeking or are in recovery. And DMH DDSUS currently provides funding support for 2 peer-run wellness centers. One is Green Tree, which is located in Winston-Salem, and the other is No Wrong Door, which is located further west in Franklin, I think. And this slide has some really nice pictures of Director Crosby, and I think I see Anne Marie Webb there during their visit at Green Tree in Winston-Salem. And so the peer-run wellness centers are supported with funding from the Mental Health Block Grant. I believe also there's an RFA currently posted for a combination peer respite, peer living room model that will provide funding for 2 new programs. So if you're interested in that, the RFA is on the DHHS website. And I think applications are coming up due pretty soon, maybe September 20th. So check that out if you're interested. And next slide. Okay, this slide is about a mobile app resource that's available free of charge for individuals seeking or in recovery, as well as for certified peer support specialists. So DMH DDSUS, in partnership with Trillium Health Resources and Chest Health, rolled out the Connections mobile app, which offers peer support and other recovery tools 24/7. It offers people the opportunity to be part of a supportive recovery community and a way to stay focused on recovery by tracking and celebrating milestones, accomplishments, as well as support and encouragement and other tools. So the Connections app, as you'll see on this slide, excuse me, is is for individuals that are seeking or in recovery. And so far, we've had 951 people enrolled, and 530 of those have actually onboarded, and they're using, a lot of the features of the app. And then there's also a peer-to-peer connect feature that's specifically designed for certified peer support specialists. And it provides a platform for peers to connect and support each other in their roles as certified peer support specialists. And as you can see from the slide, 130 peers have been onboarded for this feature of the application. Excuse me. If you're interested in accessing this free app, as you can see on the corner of the slide here, there's a QBR code, and you can also send a text to the number that's beside the QBR code. Again, it's free, and it is a really good source of support for individuals that are in recovery, seeking recovery. It's 24/7, if you need something in the middle of the night or whatever, it's a nice resource. So thank you. I think that's it for me. I believe I'm turning this over to Sydney now for the next section. Thank you.
Sydney, just one real quick, sorry to interrupt you, but Dee Dee, I just wanted to thank you for coming to talk about recovery, and thank you for what you and your team do every day to support recovery here in North Carolina. So
Thank you, Dr. Crosby. I
I
appreciate
don't
it.
know if
Thank
y'all
you.
know Dee Dee and her team, but they're special and awesome, and they're very recovery minded. And I love that. I love that. So thank you, Dee Dee.
Thank you.
Over to you, Sydney.
Why, thank you. And thank you again, Dee Dee, for that lovely presentation. I'm Sydney Hyman. I currently work for the quality management section here at the Division of Mental Health. And today I'm honored to be able to provide a little bit more insight on the Perceptions of Care survey that we host every year. So the Perception of Care survey administered by mental health and substance use treatment providers is one of the ways our division demonstrates the outcomes of our service system to our federal partners at SAMHSA, and we use it to measure overall quality of service. Survey administration is currently underway and will continue to go on through September 20th. It originally started August 12th of this year. And then mental health and substance use treatment providers should invite consumers who receive a tailored plan service during the survey administration period, or who received a service in June and July and have not been discharged yet to complete the survey. The survey itself is available in both English and Spanish and may be offered via web-based or as a paper and pencil copy. The provider page that is linked on the slide is our web location where providers can access the survey. Any questions about the survey itself can be directed to either a tailored plan Perceptions of Care survey coordinator or sent to the Division of Mental Health at the email that is described. Next slide, please. All right. So I would like to take a few minutes to share with you the 2023 results from the Perceptions of Care survey. The link that you will see on this slide will take you to the full report, as well as any prior year reports that you might be interested in. In fiscal year 2023, we had over 5,000 respondents. 69% of the respondents were adults, 19% were youth, and 12% represented children and families. 70% of respondents were seen for mental health treatment, and 30% were for substance use treatment. I'll give you a second to look. All right, and next slide, please. Okay, so surveys for adults, youth, and child/family members include a small number of demographic background questions, as well as the National Mental Health Statistics Improvement Program survey questions for each age group. The national survey questions measure perceptions about the services individuals have received in the past year. And this slide shows the various survey domains and types of questions asked related to access of service, treatment planning, quality appropriateness and cultural sensitivity, outcomes, functioning, social connectedness, and general satisfaction. During the pandemic, the division also added state-developed questions related to use and perceptions of telehealth and have continued to include these questions again this year. We will look at some of those results in a few minutes. Next slide, please. So as we begin to look at the data, overall, larger percentages of adults with primary substance use services compared to those with primary mental health services reported positive perceptions related to both outcomes, functioning, and social connectedness domains, as shown in the graph. Significantly, larger percentages of both males and females in substance use treatment reported positive perceptions in the functioning domain compared to males or females in the mental health treatment. All groups perceived access to services favorably. Any error bars on this graph show the 95% confidence interval around the national survey domain positive percentage scores. If there are any scores with non-overlapping confidence intervals, that just means that the results are significantly different. And at this moment in time, there are none. So that's great news to hear. All right, next slide, please. So for adults, scores are fairly stable over time and generally positive. Domains with high satisfaction include quality and appropriateness, which includes the fact of whether or not staff believe that I, the consumer, can grow, change, and recover, whether or not staff are sensitive to cultural backgrounds, and if I was, again, the consumer, helped in order to get information to take charge of managing my illness, just to name a few. For access, that includes location and convenience, the ability to be seen when needed and to get all of the services that the consumer thought they needed. And then general satisfaction, which reflects liking services, choosing the same agency despite having other choices, and would overall recommend this agency to a friend or family member. Adults had less positive response in the areas of social connectiveness, which includes questions like, in a crisis, I, the consumer, have a support from my family and friends. I have people whom I can do enjoyable things with, and I feel like I have a sense of belonging within my community. I will hand this over to Kelly just to address some of these areas for improvement and how the division has some strategic plan initiatives in place to support those.
Thank you so much, Sydney. And just to take one step back before I talk about what we've put on the bottom of this slide, this is a lot of information. So what I want to just highlight a few things that Sydney said before I talk about how we're responding to this data. This is a survey we do every year. We have to do it. We have to report it to SAMHSA. And remember, SAMHSA manages our federal mental health and substance use dollars. So my friends on here with IDD and TBI are like, where's my survey? There, but also remember, people with IDD and TBI have mental health and substance use needs too. So they may very well be captured in this. But what this survey is looking at are people who are using mental health and substance use services, okay? This is about their perception of care. It matters to us. It matters big time, right? We want to know people who are receiving services in our public system, okay? A Medicaid service, a service for someone without insurance. What do you think of the care that you're getting? And so it's important, A, that we share this with you every year when it comes out. We share it with our LME MCOs, we share it with our providers, and we say, okay, in places where we need to do better, what are we doing systematically to do better? And so we took this opportunity to say, for adults, for example, as Sydney shared, we're struggling on some of our lowest measures are social connectedness and outcomes. So we need to ask ourselves, because it's the right thing to do, well, then how are we focusing our money and our programs, our interventions on those areas where people are telling us that we should do better? So some of the things that we're focused on in our strategic plan, if you read the draft, you saw these things, things that you saw in the draft, you'll see in the final things we'll be putting money, resources, time, and energy to, and asking our LME MCOs to do the same, are things like expansion of peer services. We believe that social connectedness, connected to supports, is huge and important. So we are working towards amplifying peer services in so many ways, as you know, everything from certification to getting folks in jobs, to making sure we have enough peer living rooms, wellness centers, respites, refuges. That's for you, Lori. Threw that one out there. So important recovery centers. Dee Dee talked about those. So that's important for us. NAMI on campus. We want to make sure that we're reaching college students and that we are expanding NAMI on campus, but also NAMI support groups for caregivers and siblings, right? So caregiving siblings, NAMI on campus is a focus of our expansion efforts. Dee Dee talked about collegiate harm reduction. Think about that. Think about college. If you ever had the privilege of going to college, right? I did, and I'm grateful for it, right? What do folks do on college campuses? What is the culture, right? So we want to make sure that we're allowing folks social opportunities where they can maintain their recovery and their sobriety. They have fun. They're kids. They have fun. They engage with others. But they need safe spaces where they're supported. There's no stigma. They feel welcome and accepted. So that's something that we're focused on. And clubhouses. Love clubhouses, y'all. Clubhouses do amazing things for people with serious mental illness, help them get jobs, help them connect, help them maintain recovery. And it's a wonderful place for social connectedness for folks who are struggling with social isolation. So just look at, again, these are examples of things we are focused on because these are areas that need improvement in our system, all right? Now, Sydney's gonna come and she's gonna talk about some of the survey results for youth. Back to you, Sydney.
Thank you again. I want to just chime in really quickly and say this just shows how impactful data is in helping move the needle a little bit. So I appreciate you, Kelly, for chiming in and showing a little bit more about how that works. But now if we can continue on, we're talking about, like she said, the youth population. In this case, we are categorizing that as age 12 to 17. And overall, that demographic generally had a positive perception of services. The highest satisfaction is with cultural sensitivity and general satisfaction. And then youth survey domains with the lowest satisfaction also include outcomes and treatment planning. Youth perception showed less satisfaction with services helping them to handle daily life, getting along with family, friends, and other people, improving in school, coping when things go wrong, and satisfaction with family life right now. Another area that youth had lower satisfaction was treatment planning, which includes choosing services, choosing treatment goals, and participation. So Kelly, if you don't mind chiming in again and talking about how those strategic plan initiatives can help address that.
Thanks so much, Sydney. Did you hear all that? Do you have teenagers? You were a teenager once. Imagine the experience of a teen, the kind of outcomes they want for themselves and for their family, and the type of agency they want to choose the treatment that makes sense with the people that it makes sense, right? We hear that, right? What a surprise that those are the survey results, but we also can do better in those areas. And I will say in this place, there's these interventions that we're putting in place, these programs that we're strengthening, but there's more work to do in this space. There's a lot more work to do in this space. One of the things we're working on are youth-focused crisis interventions, like the MOORS program. This is crisis response specifically for teens and their families, teens within families. They not only respond to the crisis, and the goal is to help the young person stay at home, is to continue to support them and their family with ongoing services for some time. The next thing is there are some of the young people that we support in our programs that are involved in the juvenile justice system or have had brushes with the juvenile justice system. We know that families and individuals who are in the scenarios, youth, they need the right services and supports. And some of those are peer-run supports. Those are other evidence-based services that help a young person. And so we are working right now to look at that constellation of services and supports that we do that we provide for individuals who are involved in the juvenile justice system and their families, and we are revitalizing those programs as well. We also know that we need more access to substance use services for adolescents across the continuum. Again, a lot of those are peer options or intensive outpatient options, outpatient options, peer-run options, school-based options. So there's a lot of different things we need to do to make sure that we have offerings that teens are aware of, that they feel like actually culturally respond to them, and also that they have choice and they have agency, right? We all deserve that agency when we're making choices about the type of services and supports that we want. So there's a lot to do in this space, as you see evidenced by the data. So this one is, I feel like we're just kind of cracking open more that we can do to support youth in our communities with both mental health and substance use needs. Back to you, Sydney.
Thank you. There was a slight lag to my camera. My apologies. So next we're talking about children and families. That age demographic is identified as age 11 and younger. And also they generally express positive perceptions of services as well. The highest satisfaction is with cultural sensitivity, treatment planning, general satisfaction, access, and social connectedness. Areas that children and families express concern were in functioning and outcomes. These questions include, as a direct result of services, my child is better at handling daily life, getting along with family and friends and other people, improvements in school or work, and being better able to cope when things go wrong, able to do things that they want, and whether or not they are satisfied with family life. Kelly, if you don't mind chipping in and talking more about how there are strategic initiatives in place to address these as well.
Thanks, Sydney. Rookie mistake. I forgot to take myself off of mute. So one thing I want to say about children's initiatives across the family spectrum is at DMHDD SUS, we are very focused on crisis and the residential service array for children. But please know that we are in close partnership with DSS and also our Division of Child and Family Wellbeing, DCFW, because we feel like we want crisis and out-of-home placement to be of last resort, right? So we are working with our partners to make sure that we have community-based services for youth in their families, for children in their families. And we're doing things early on, right? Between moms and their own mental well-being and babies and young children, right? So there's a lot of that happening in the DSS and DCFW space. So know we're collaborating with them. But in addition, you'll see in our strategic plan that we're focused on improving and redesigning this, the spectrum of residential treatment programs for children. So that's levels 2 group, 3 group, 4 group, PRTFs. We are investing a lot in redesigning how that system works, how children enter the system, hopefully stay briefly in the system with high caliber, high quality treatment. Their families are getting the treatment they need, and children are able to return to their community, their family of origin, a foster family, a kinship family as soon as possible. So that's a big priority for us, making sure we're improving the functioning areas that you heard Sydney talk about, which is how children and families are communicating, getting along together. And you all know a child and family really they both need support, right? The child within the family. And so I mentioned child residential redesign, but also maternal mental health. Some of you probably know that in the maternal substance use space, we're national leaders. Again, credit to Dee Dee and Sterling Scott Robbins here on the call and their teams. We're leaders in that substance use space, but we want to make sure that we're doing enough to support maternal mental health as well. So we will be looking at our service and system supports in that space, because healthy moms have healthy kids and healthy families, and we want to make sure they're happy and healthy as well. So make sure that we have the right constellation of services and supports in that space in North Carolina. All right, I think back to you, Sydney.
Yes, we're wrapping up with this final slide just to spin back about the telehealth portion of the Perceptions of Care survey. Like I had mentioned towards the beginning, we added these sets of questions in order to address the changes in, structure of the survey and how it took place. So for the telehealth portion of the survey, there were just under 5,000 respondents who answered questions regarding telehealth use, perceptions of use, and obstacles to actually accessing the telehealth portion. Across all age groups, 41% of individuals surveyed reported they or their child received telehealth services in the past 6 months. The upper graph shows survey respondents by LME MCO or by Tailored Plan now that reported receiving telehealth within the past 6 months. Perceptions of effectiveness of telehealth compared to in-person treatment were very positive. In the bottom graph, around 30% of adult and youth respondents reported telehealth services received were more helpful than seeing their provider in person. 78% of adults and youth respondents rated telehealth about the same or better than seeing their provider in person. And for child family respondents, 59% reported that telehealth was the same or more helpful than seeing their provider in person. So after looking at that data, I just want to put a reminder out there that the complete 2023 Perceptions of Care Survey report can be found on the DMH DDSUS reports page under the Perceptions of Care link. We also look forward to hearing from you and your families about your mental health and substance use treatment again this year. And if you have any other questions, just drop them down in the question and answer. But back to you, Kelly. Thank you again.
Thank you, Sydney. Thank you for sharing that data. And one of the things we want to continue to do in our side-by-sides is bring data. Remember, I said that one was very much about perceptions of care for substance use and mental health services. We also have our national core indicators, right? So we get a survey of the experience of folks with intellectual and developmental disabilities, as well as the state of the IDD workforce. So we participate in those surveys every year, and we'll be sharing that data here with you as well. Again, the goal is to be transparent with you about data and also to show you and to hear feedback from you on how we should use that data to focus services and improve services and supports in our system. I think that last slide that Sydney shared was just really telling, right? We all need to take notice of that. I've seen those results replicated in other situations, including when I was at Medicaid. We saw the same, that people in general, not everyone, but in general seem to be responding very well to mental health and substance use services provided via telehealth. And I think that's very important for us to pay attention to. So that's an incredibly important finding. And one of the things we're interested in exploring is how we can leverage telehealth more to make sure we have even more and more access in our state, especially in places where it is hard to find workforce access. All right, I think the last big topic we have today. So we've covered a lot of things. It's a lot of months to celebrate today. We wanted to hit some of our recovery highlights. This Perception of Care survey is live in the field, so we wanted to tell you about last year's results and encourage you to take the survey again. And lastly, I want to tell you about our mental health block grant. So remember, well, that's one of our big federal funding sources, our mental health block grant. SAMHSA gives this to all states, right? We have to apply for it, of course, and we have to show that there is a commitment here, and we're spending state dollars on mental health services as well. So it's not a freebie. We have to show them our commitment with our own state dollars. And it's specific in that it has to cover things called first episode psychosis programs. It has to cover crisis services, and it has to cover mental health and treatment. So what I wanted to do to you today, or with you today, is to share what we are covering this year. Some of you know about it, some of you don't. But again, I think it's really important that you see how we're using our funds to support some of our priorities here in the state. So the first category of service that we were required to cover are first episode psychosis programs. And this is the one I'm actually going to dig a little deeper on today. We don't talk a lot about this, but we should. So first episode psychosis, it's been a federal priority for a long time. It's actually a priority here in the state and one we want to talk about more and promote more, okay? I'm going to tell you a little bit more about it in a bit. But we are doing some new things in this space and some recurring things in this space. So one of the things that we're doing, and I'll tell you what a first episode psychosis program is in one slide, but one of the things that we're doing is we're working with our LME MCOs to make sure that our first episode psychosis programs are coordinated with our ACT teams, which are more community-based. But again, we're talking often about a very similar population, right? Individuals with serious mental illness. First episode psychosis just means the first episode, first time, right? What a time for intervention, right? A young person, 17, they and their family may not know what has happened. And our first episode psychosis programs can really help. Let's engage and connect them to our community-based ACT programs as well. So we're working on that. We're continuing to fund UNC Charlotte, and they help manage all of our programs, make sure they're using the best evidence-based practices, sharing data with us so we see how all the programs are going. So they're a very good partner in making sure the program is high quality to standard across the state, and they share that data with us. They are also working on adapting the model to reach more marginalized populations. That's incredibly important, right? First episode psychosis affects us all. We have to make sure that all folks are comfortable and this program is effective and actually culturally humble and working to support marginalized populations. So they're working on that now. And we're also, I'm going to show you in a moment, the 5 sites. So we're expanding the 5 sites. We're trying to get more people in. And we also want to market and expand awareness of these first episode psychosis programs. Next slide, please. So what is a first episode psychosis program? It's what it sounds like, right? And our program, our first episode psychosis program here in North Carolina is Coordinated Specialty Care Clinics. It's a big long name, FEPCSC. But just think about it for a minute. There are some of you on this call right now who this isn't part of your life experience. And so this might mean nothing to you. But there are plenty of you who are like, yep, been there, right? So imagine that you have a 17-year-old and they have a first episode of psychosis, meaning, let me just pick an example. They become incredibly paranoid and they have maybe some paranoid delusions and they won't eat their food because they think that it is poisoned, right? We know that's not rational. They've never perhaps behaved this way before or thought these things or felt such distress at something like this before. And your child won't eat and they end up hospitalized. Now, if you've never experienced anything like this before, you might be incredibly confused and not understand what's going on and may be afraid as well, right? But what happens is your child, your 17-year-old child might get hospitalized, gets adequately diagnosed so you know what's going on, maybe gets a low-level medication, spends a bit of time in a hospital and is doing well. But this is so new for you and so new for your child, right, in your family. And a first episode psychosis program, our coordinated specialty clinics, what they will do is they'll help you. It's a very recovery-oriented approach. And I'm going to show you some data in a minute, which is very exciting, that helps yourself as a parent, your 17-year-old child understand what happened and that it doesn't have to be life-defining and that it's okay and you don't have to be afraid. And here's what it means. And here are skills for you and your family. And let's move on with life. Let's get a job. Let's go to school. Let's get an apartment, just like any other 17-year-old would do, right? So it really focuses on good education and support for the individual and the family. And it's a recovery-focused program. Helps with care management, education, treatment, medication, whatever it is a person needs. Next slide, please. Here's where we have our 5 clinics across the state. Well, I guess we have 6 now, a new one. We Care 2 is opening up in Burnsville. So again, not everywhere. So we need more, right? And we need to make sure these programs are well known. Here's why. Can I show you the data? Go on the next slide. Look at the data. Look at this. Look at these outcomes data. So on the left side is where we first started, right? Yellow is those who were not working and not in school after their first episode psychosis. The dark blue is they were in school. The green is they were working, and the light blue is working and in school, right? And that's what we want. We want this young person to finish school, to maybe go to college if that's their thing, to get a job, to get an apartment. Look where we are in our 5th year. Do you see how the vast majority of people in first episode psychosis programs now live a life resilient in recovery, go to work, go to school, finish college, get a job? This is what we're talking about, okay? Next slide, please. Same thing, social functioning, right? If you look at the baseline year, right? Dark blue is the color we don't want. There's an individual's psychotic symptoms. Maybe as I explained to you, paranoia, I'm afraid to eat my food. I think someone is going to hurt me. In our baseline year, when the program first started, people had major impairment. You know, that's how folks are coming in. Over time, year over year over year, and these are long-term results for the people in the program, social functioning is great. Social functioning, right? It's such a term, but it just means you have a life. You have friends, go to school, you have a job, you have an apartment. You do things on the weekend, right? That's what social functioning is, right? So people who are in our first episode psychosis programs, year over year over year, continue to do very well and live a good, resilient life, as we want for everybody, right? Okay. So do you see why these programs are awesome? And we want to make sure people know about them and that we continue to fund them so all people have access across North Carolina. Next slide, please. So that's the first thing. First episode psychosis programs. And that is worthy of its own lunch and learn. So people can learn more about our first episode psychosis programs from our experts here at UNC and DMH DDS-US, but they're awesome programs. All right. Second category that we fund with our mental health block grant are our crisis system investments. And for us, that means continuing our peer warm line, our peer respites and refuge, our co-responder models. Co-responders are when people call 911 and an officer and EMT goes out, can we get a behavioral health professional too? That's our co-responder models. And we're continuing to fund our Hope for NC line. And that really is our crisis line for people to use during natural disasters, like when we have hurricanes, which we have here in North Carolina. So we'll continue to fund that. On the next slide, that's crisis. And I just saw the clock, so I'm low in time. You know that we're investing a lot in our crisis system right now. So we have someone to call, someone to respond, and a safe place to go. So lots of investments from General Assembly funds, but know that our block grant funds continue to supplement and support crisis programming in North Carolina, okay? The last thing, what I'm very excited about, and I've got 2 slides on this, is our broad category called mental health treatment program investments. Some new things we'll be doing are our anti-stigma campaign. Want people not to feel shame. You don't need to feel shame. You don't. Why do you? 1 in 3 people have mental health or substance use needs. It's part of the human condition. So our anti-stigma campaign, and also our continued efforts to make sure people know how to find services. We're working on a website right now. It's going to be called findcare.com or something like that, so people can easily find services here in North Carolina, services and supports in North Carolina. We're continuing to use our dollars to fund family and caregiver support. So NAMI that I talked about before, caregiver sibling programs, NAMI on campus. But we also, as you know, released an RFA for family and sibling support organizations. We know that families are integral. We know that families support their loved ones in recovery, and we want to make sure they're getting the support that they need. We're of course expanding peers. I hope you've heard me say that. Everything from certification to peer scholarships if you want to get certified. So peers and more peer respites and living rooms across the state. We're continuing to fund our veterans programs, and we'll be doing a new Ask the Question campaign. We are gonna do a lunch and learn soon on all of our veterans programs. If you know me and my story, veterans are near and dear to my heart, and making sure they and their families get good access and treatment here in North Carolina is incredibly important to us. And our new RFA went out. We got 46 applicants. I found out this morning, which is like a record for us. This is access for where people need it in the ways that they need it. It's a very broad treatment RFA that says, how are you helping people from a faith-based community perspective, older adults, the community of LGBTQIA+, immigrants or people with English as a second language? How are you helping them to access or gain services through your organization, which may be really different than than very traditional ways? It needs to be culturally humble and appropriate. So we want community-based organizations to apply for funds so they're helping people gain access through those vehicles. We'll continue our deaf and hard of hearing services and our voices of Affrilacia, because remember, it's very important to us that we're doing all that we can across the state to make sure marginalized populations are able to access services in a way that is culturally appropriate for them. Next slide. We have our mental health block grant funding opportunities. I mentioned all of those, but this was our pretty announcement that went out. Next slide, please. We are super out of time, but there's one thing I want to say as we're closing. Today was somewhat heavy on mental health and substance use. Our survey, our mental health block grant, our recovery services, and we got some questions about IDD services and supports. So I want folks to hear me say that our strategic plan will have a lovely section that is fairly, but not completely comprehensive on what we're going to do now for the IDD service delivery system and what we are going to do in the future. We're trying to tee both of those up. But if you look at our Inclusion Connects campaign, that's where we are focused on a comprehensive strategy, not bits and pieces. Bits and pieces might be, we are able to work on this and this now, but comprehensively, we need a package of things to help get people in services and off the wait list. We're doing a lot of intervention in that space. You just don't feel them all. So we'll explain them all to you. Help direct support professionals get in and stay in the workforce, right? And lastly, housing. I said on other webinars, this is a place where we need a wonderful assessment and a plan for housing, right, y'all? So a lot needs to be done in that space, but know that supporting people with IDD and making sure we have a comprehensive plan for this state, it is a priority for our division and it's part of our job. It's part of our mission and vision, and we take that very seriously. So hopefully you will tune in as we talk more about Inclusion Connects and all the interventions there, which is a more comprehensive plan for folks with IDD. And you see a lot of the bones of that in our strategic plan. All right, it's 3 o'clock. I think folks try to answer questions as we go along. The IDD ones are the ones that we didn't get to touch much about. And I know we didn't cover a lot of them in this session, but I wanted to hit on them ever so briefly. And there might be some questions we'll follow up in email. And that is all. I thank you all for joining us today for all the many things that we covered. One thing I do want to flag is that we had mentioned the Child and Family Specialty Plan. We are working with Medicaid, so I kind of want to apologize. I should have said this up front, to get more information to you about the Child and Family Specialty Plan. We have lots of questions, just can you give us some more information on it, but also like tell us when it's going to begin and help us plan for it. So know that is top of mind for us, and we are working with our colleagues at Medicaid to get more information and more opportunities for you to ask questions and for us to share information with you about the Child and Family Specialty Plan. So know that it's on our radar, and we are working now to share more information with you. All right. Thank you all for coming today. It was great to spend time with you. Special thanks to Dee Dee and Tina and Sydney. I love it when you get to meet members of the team who really make the magic happen. And thank you all for coming today. Okay. Bye, everyone.